Hey there, Dr. JP Gidry here with the low back pain series on building things back up. First move is going to be a hip hinge or deadlift movement. Demonstrating here with dumbbells, but we can do with a barbell or kettlebell as well. The key here is sitting back in the hips, keeping your back nice and straight, lats engaged, shoulders pulled down and back, core nice and tight. Next move is a little hip and back rotational movement. So one leg forward, one leg back. We're working on restoring mobility of the hip and spine in a more weight-bearing or loaded position. Driving the pelvis and the shoulders away and then in towards the forward leg as you move. Again, none of these movements should create a lot of pain, although you may feel some pulling and tightness sensations. Next is a simple squat. I prefer to start with a goblet squat, which is taking a dumbbell or a kettlebell and holding it in front of you, squatting down and back, letting that pelvis drop down in between the knees. Again, back straight, core nice and tight, no pain with this. As we get into some upper body movements, push-up is one of the better upper body movements, keeping a nice straight line through the body, elbows about a 45-degree away from the body, neck nice and straight, keeping that core nice and tight, not a lot of movement through the hips. For an upper body pull movement, we're going to do a bent over row. The beauty of this is we're getting our upper back as well as isometrically challenging the low back. So similar position as the hip hinge or deadlift. We're keeping that spine stable and rowing down to our side, keeping those shoulders down and back. Next, we're going to come to some trunk anti-rotation movement. We call this a Pallof press. So the band is trying to rotate us. We're engaging our core and our trunk muscles to resist that rotation. So we're keeping those hands directly in front of